because
Yeah,
I
it,
might be wrong.
yeah. I mean, these things, politics, isn't there? Anyway, I've got a meeting.
Good morning, everybody. It's just on 9 o'clock. We'll just wait a couple of minutes as a few more people are joining us, and then we'll start. To C3 Collaborating for Health and Society of Occupational Medicine webinar. I'm Christine Hancock from C3, and it's my pleasure to welcome you here today. C3 is a global charity headquartered in London, working globally, aiming to prevent chronic disease, looking at particularly the risk factors, smoking, lack of physical activity, and what we eat and drink, which are drivers of the main illnesses, chronic diseases, and which impact on people at work. And those same risk factors, of course, have shown themselves to be significant risk factors for COVID-19. So today, we're particularly pleased to welcome Manuel and Louise, who are bringing really practical help to businesses, to workplaces. And I'm going to hand you over to Nick Parr, Chief Executive of SOM, who's going to chair the session this morning.
Good morning, everyone. I hope you're all well. I'm a bit croaky from going down the pub yesterday evening. I couldn't really cope with it, so I'm had to go home early. So I'm gently easing myself into socialising. Enough about me, but Society of Occupational Medicine, we are the kind of leading organisation of occupational health in the UK, and we produce the Journal of Occupational Medicine. Members include occupational health doctors, nurses, allied health professionals, people who have an interest in occupational health, and we host various networks from sleep to musculoskeletal to academic side, and we're very pleased to co-host with C3. I think there's a kind of preventive aspect to workplace health, which often occupational health gets frustrated, wants to do more on. But also, there's a moment now, isn't there, with Boris Johnson and political leaders, Nicola Sturgeon saying the lockdown needs to stop earlier because of mental health, where there's real interest in mental health and mental health in the workplace as a way of kind of improving people's ability to kind of, a bit like me, kind of get back into some kind of normality. Although the way that normality will be, I think, is one where we want to, with organisations like Business and Community, Public Health England and others, make sure we, as people say, build back better. So there's an opportunity to right some of the wrongs, or even some of the wrongs that have happened. And I'm sure Louise will talk about say the issues around domestic violence, trying to sort of correct them, or things that have happened, hasn't been good over the pandemic. So Public Health England and Business Community, both real leaders in sort of health and work, and we really hope the new kind of Public Health England, whatever it's called, National Institute of Health Protection, or the Office of Health Promotion, will have a health and work aspect to it. And Business and the Community have done over the years enormous work today in partnership with Public Health England in terms of health at work. So they produced this summary toolkit which focuses on health and wellbeing at work, and it really provides practical evidence-based guidance on how employers can support their employees to help improve the health and wellbeing of their workforce. And I think that's one of the quandaries in this area. Sometimes people just don't know where to start and feel a bit of lack of confidence, and I think that this toolkit really offers that confidence, and it's been really a labour of love between Manuel and Louise to try and get this toolkit to the best possible position, and it really is. So Manuel Ramos, to introduce Manuel, is the Public Health England Programme Manager in Health at Work, and we've been very pleased to be working with Manuel and the PHE team on webinars, which some of you may have been at, and you can see on our website in terms of some of the issues around job insecurity, redundancy, stress, mental health strategies. So do look at those webinar outputs on our website. And Louise, well, we gave honorary membership to Louise for her work, generally in terms of work and health, and she's one of the leaders in the field. She's Wellbeing Director at the Business in the Community, and she's also been recognised not only by us but by Institute Directors and REBA. So she's been a real advocate for employee mental health at a strategic level, and that's where that leadership is required. I think, you know, people who work in workplace health need to talk to boards, the C-suite people, and particularly, I think, an issue in terms of mental health and physical health being on parity. And one of the things that we've been talking to organisations, particularly in the health field, is that if there's a reasonable adjustment required for mental health issues that perhaps an occupational health person reports to a manager about, then the manager needs to take that on and make those reasonable adjustments. We don't want the situation where we had a blog on our website a couple of months ago where, you know, someone has just exited from the organisation because of a mental health issue. You know, people can, obviously reasonable adjustments can happen for mental health, and people with mental health issues can continue. What we don't want is people you know, just having a situation where they're in effect discriminated against. So BITC, they campaign and support and challenge employers across the UK, and are very intelligent on that, looking at things like intersectionality between different issues. And it's not only just mental health, physical health, it's all other things like domestic violence and suicide, etc. And sort of navigating, the BITC really help people navigate through what is important, offering a kind of total package as such for their members. And I'm sure Louise is going to talk about some work that's coming down the line linked to the domestic violence abuse bill, which is in May. So enough from me, although I'll be there in the chat looking at what you're saying and maybe putting some comments in. This is quite a short presentation, quite intense, and, you know, we need to focus down on what it's saying because it's been highly worked. But I do hope today, as much as you know, we might be feeling a bit Friday morning-ish, do put stuff in the chat, come off your video. I know it's nice, nice to hide and not put on your video, but, you know, come on your video and get involved in discussions. But the point of these breakfast seminar webinars is really to allow that conversation to happen and give us all confidence when we leave to sort of take it forward. And so, you know, don't be shy, share some of your issues, problems. You know, don't worry about asking silly questions. You know, it's something where we hope we can offer some clarity to you. Okay, so enough from me, and I'll first hand over to Louise Acton. Welcome. Thank you for speaking, Louise.
Thank you very much. I'm just trying to get my, hold on. Is that coming up from?
That's coming up, and then you won't go to slideshow from the beginning, and then you're there. Great, lovely.
Well, hello everybody. I'm Louise, and it's a real pleasure to be here this morning. I was just, Christine and I have done a lot of work together in the past, and actually, Christine, I was just thinking the first time I met you was in a parking bay somewhere in West London, or it might have even been North London, that we'd never met each other before, but you'd hired a zip car and we were driving up for the Tory party meeting up in, I can't remember where it was even, and really
somewhere in the middle, Nottingham or Sheffield, I think. Yeah.
So I have a long association with Christine, and it's lovely to be here today, and also with Nick. And Manuel and I have literally spent thousands and thousands of hours together working on the suite of 8 toolkits that actually came before the summary that we're also going to talk about, which came out in January this year. And my word, there's a big history behind actually even getting to that summary. We didn't just whip the summary out of our back pocket. It was quite a long journey, and in terms of engaging a lot of people, in terms of thinking about this whole person, whole system approach to health and wellbeing. Manuel, I don't know if you want to add anything to that.
No, I just want to echo. For me, it's been, you know, it's been a journey in terms of when we started doing these toolkits back in 2015. And you know, just to say, I think for me, it echoes how important it is for government to work with, you know, with business and the third sector, and in the spirit of co-production. I think that's when we produce better guidance and better resources.
Well, anyway, Manuel and I, with stakeholders, have been on quite an epic journey. So please don't view this as just some little kind of summary toolkit, because it's actually a lot more profound than that. So, business in the community is, we are a business-led charity. So we have hundreds of members, mainly large organizations. Basically, our kind of big strength is around our convening power to actually drive change. But to do with this agenda is we are very much around achieving sustainable mental health outcomes, and we know there is no health without mental health. So everything we do is aligned to UN Sustainable Development Goals, and obviously looking at mental health and well-being, we're looking through multiple lenses of good work, inclusion, and we're now beginning to look at well-being through the lens of the environment, particularly around connecting with nature. So Public Health England obviously couldn't be more different than business in the community in terms of our audiences. And how this marriage made in heaven came about was, I think it's fair to say, I don't know how many of you know Dr. Justin Barney, who's now Public Health Director in Birmingham. But Justin is a rare breed of civil servant who basically kind of doesn't talk civil service. He actually has a lot of knowledge about the business sector. So Justin was working at Public Health England with Manuel, and basically it was Justin who really spotted this partnership as a huge opportunity, which is how this kicked off. So I guess what was innovative about this is that actually for a civil service, because Justin kind of was very visionary in his thinking in terms of approaching business in the community. In terms of Public Health England having a next to, a totally exemplar quality assurance in terms of evidence base, but business in the community having that credibility with business, being able to talk the same language, and obviously our dissemination channels, as well as Public Health England's. And I think the other thing that, was a huge ambition is we really tried hard, and we actually did extensive piloting with all of the toolkits around testing them with SMEs as well as large corporates. So in terms of as I said, the quality assurance that Public Health England brought to the party was next to none. So for all 8 toolkits, which I'll come on to in a bit more detail, the consolidation of the best evidence, and in some cases, on some topics, there was hardly any evidence, which we'll talk about in a bit more. But where there was evidence, we absolutely used the best. And I can tell you, getting through Public Health England's publications board is very, very, very challenging. And it's been a nightmare, actually, but there we go. So we've really focused on the business and the social case. I mean, obviously, we're a responsible business charity, but in terms of engaging business leaders, although a lot of them will do the right thing because it's the right thing to do, it really does help if you've got a really compelling business case, but also the moral case is really important as well. There's a consistency of format in terms of clear stage, checklist of actions, and as I said, appropriate for all organisations, whoever you are. We've gone quite big into the duty of care and legal context, and particularly, there was, for example, with domestic abuse, there were still many employers out there who really don't realise that actually domestic abuse is a crime, and they do have a duty of care and a legal responsibility, even if their people are working from home. We've included adaptable policy and processes, frameworks. because the common thread throughout the suite is around mental health, there's a lot around disclosure, and obviously that applies to suicide prevention as well as domestic abuse. So disclosure is a really big issue. Protocols, particularly around suicide prevention and postvention. And we've got an absolutely superb range of case studies throughout all 8 toolkits, from public, private, small and large organizations, and freely available resources. So here they are. These are all freely available, and basically to do with getting to the summary, we didn't actually plan these in any particular order. They kind of evolved. So the first one was the mental health toolkit, which was actually produced in 2016. And the most recent one, the domestic abuse one, was produced in 2018. So as I said before, the common thread uniting all of these toolkits is mental health. And obviously we've got mental health on the sort of preventative end of the spectrum with the mental health toolkit, but also on the severe end of the spectrum in terms of reducing the risk of suicide, crisis management in the event of suicide, and domestic abuse in terms of physical and psychological health as well. And then obviously to do with MSK is that, again, is very much linked in with mental health, as is drugs, alcohol and tobacco, and obviously to do with diet and weight. So they're all freely available, and they were produced, as I said, between 2016 and 2018. To do with taking this whole person, whole system approach is what underpins those 8 toolkits, is business in the community's evidence-based work well model, which is, I love this, a biopsychosocial framework. So it really takes on board the whole person, and it's primarily around prevention, but also takes that 3-pronged approach in terms of prevention, early intervention, and active rehabilitation. So when we were designing these toolkits, and indeed what the sort of cumulative resource, which Manuel's going to talk about to do with the summary, it really is that kind of integrated whole person, whole organization approach. So the first toolkit, which has recently been updated, so a new version went onto Business in the Community's website in January this year. So it is up to date now, and we are really promoting the mental health at work commitment, which is the commitment that came out of the Stevenson Pharma review, underpinned by the 6 evidence-based standards. And if you haven't already made that commitment, I would really urge you to think about it, because even if you're just starting off on your journey in terms of those 6 evidence-based standards, plus there's a whole wealth of kind of information on Business in the Community's website, and indeed the Mental Health at Work portal site. So when we designed our first toolkit, it was before the Mental Health at Work portal. It was trying to actually consolidate all the best resources, all the best evidence in one place. And as I said, that's just been updated, so you can find it on our website. Obviously, along with mental health, musculoskeletal issues are the biggest cause of lost working days. So we actually worked, well, in partnership with ARMA. So this, again, in terms of expanding our kind of model working with a kind of third party. And again, they actually contributed further evidence to what we already had from Public Health England. So that was really working with a load of academics, trying to translate it into plain English. And then obviously physical activity, we know that people have got into a lot of people have got into bad habits in terms of weight issues during COVID. So this is very much a live issue, and indeed with MSK in terms of working from home. We've also seen during the pandemic that addiction rates have gone up. I don't want to refer to our drugs, alcohol and tobacco as addiction, but there are issues there which are pertinent to the current situation. Now, I think you'd agree, Manuel, is when we broached the topic of suicide, this project, I think, was the hardest I've ever done. And this was in 2017. And there was nothing for businesses anywhere in the UK. There was a resource that Samaritans had worked on for schools, but there was nothing on prevention for business or indeed on postvention. And at the beginning, nobody would talk to me about suicide. It was a bit like kind of domestic abuse. It's like, oh, well, it's something that happens at home. It doesn't happen at work and it's got nothing to do with work. And obviously it's a very distressing topic. And in terms of working with Samaritans, engaging my leadership team, which is 16 kind of execs from a variety of sectors, this was a really tough call. And actually what really got us over the line on this, nobody would talk to us, even companies where they'd had extensive media coverage. And really the thing that broke the ice was PwC. They were amazing, is in terms of actually talking about both suicide that had happened and what they were doing as a result of it. And you know, this topic was so taboo, and I think that to do with suicide, we are almost certainly going to see a spike because of the pandemic. We know that in the 2008 recession, we saw a rise in suicide, but obviously with the lagging indicators from the ONS, because you have to wait for coroner's report, we won't know for certain until those figures come through. But as I said, you know, this is about an open culture. You can't manage what you can't talk about. As many suicides are preventable if basically people will actually disclose. And we know that the impact of a completed suicide is absolutely huge. And obviously the responsibility of trying to prevent contagion. So I think those two toolkits are particularly pertinent right now. This is a great example, sleep and recovery. When PHE looked at their evidence, there was hardly anything around sleep and recovery, but our business and the communities leadership team felt really, really strongly that this was an agenda that was an absolute key strand of health and well-being. And even though there was hardly any evidence, is our leadership team persuaded Public Health England, so this is an example of business influencing government, to actually produce this toolkit, and obviously to do with resilience, to do with energy. You know, sleep is a kind of absolute basic pillar of health and well-being. It really helped to put this on the map. And I think it's interesting to see that we actually got what was then the chair of our Wellbeing leadership team to sponsor the toolkit. And then domestic abuse, gosh. We produced this in 2018, And again, there was a lot of resistance, and we got there in the end. And obviously we know that during the pandemic, domestic abuse rates have absolutely spiked. There's a new domestic abuse bill basically due for royal assent anytime soon. So we are working with Public Health England as well as BEIS and the Home Office, supported by Employers Initiative on Domestic Abuse, to launch an updated version on this. It's coming out on the 13th of May. And if you're interested, if you look on Business in the Community's website under webinars, you'll see there's a freely available webinar that you can sign up to. Yeah, but domestic abuse obviously is a hugely important issue, and a lot of employers, they don't understand that this is a crime and they have a legal responsibility. And obviously spotting those warning signs is a lot harder as people are working remotely, plus as we go into the future with hybrid ways of working. So just to give you an idea of downloads, obviously mental health was our first toolkit, with domestic abuse being our last. But I think it's very interesting in terms of the levels of interest. So with that, I'm delighted to hand over to you, Manuel.
Thanks, Louise. I'll share my screen, 1 second. Can you see my slides?
Yes.
Yeah.
Yeah, great. So
Start from the slideshow thing.
yeah. Yeah, so thanks, Louise, for that. It's a really nice overview of how we produce these 8 resources, these 8 toolkits. So after producing the domestic abuse one, we felt that there was a real need to evaluate how the toolkits were perceived by employers. So PHE commissioned the Work Foundation to undertake an independent evaluation of the toolkit suite. And the aim of this research was really to assess the awareness and perceptions of the toolkits among businesses of different sizes and sectors, and to explore the potential impact of the toolkits on employer practice, but also to strengthen the evidence base underpinning the effectiveness of the toolkit suite and provide recommendations for improvement. And finally, to inspire more businesses to use the toolkits to improve workplace health. And this evaluation is available online, and the link is below. So what were the main findings of this evaluation? Well, the main findings was that the toolkits were perceived by the organisation studied as repositories of information and best practice, and providing compelling statistics communicated through the infographics, and access to additional resources. So one of the things that I love about these toolkits is the fact they have really sort of nice, neat infographics, which are really effective tools for practitioners or for people making the business case. So if you need to sort of explain why as a business do we need to invest in mental health, why is MSK an issue, these infographics are really neat and effective way of sort of highlighting the issue of this condition has on the workplace and on staff, and both from a business perspective, from a cost perspective, but also from a well-being perspective. And also the fact is, these toolkits are, act as repositories, and they link you to other amazing resources. So, for example, throughout all of these toolkits, you have links to campaigns and other resources that exist. Another key finding of the evaluation was that the toolkits were used by employers to support awareness raising campaigns and sessions on a range of staff health and wellbeing issues. For example, promoting the issue of sleep and obesity. So they're really used as a way of changing attitudes and to convince senior management of the need to act. And and finally, another really key way, another key finding really, which I found really useful, is that the toolkits were used as a way of sense checking and reviewing existing policies. So if you're an established big company, you had a policy, toolkits were a really good way of sort of sense checking, making sure, oh, actually, have we covered everything? Should we consider this? Should we consider that? And back to evaluations are really important, but I think it's also, for me, a key thing is, and I will never forget this, and this is back to the point about the suicide prevention toolkit. When I was in PhD, usually has a stand, and every year has a stand at the Health and Work Conference in Birmingham. And on several occasions, people from big businesses have come to me and said, "Thank you so much for doing this resource." And this was specifically regarding suicide prevention. Somebody was nearly in tears saying, "Thank you so much for having produced these resources. We experienced suicide in our workplace, and these toolkits really helped us as an organisation to deal with this this big issue." So I think just highlights how important these resources are. So back to the evaluation. The evaluation made 6 recommendations to improve the toolkits. One of them was about the length of the toolkit. So when we first started on, I think we were very enthusiastic. They were quite lengthy, because there's a lot out there, especially regarding mental health and MSK. So the toolkit did, the evaluation did acknowledge that we had shortened as we went along, but the importance of keeping any resource for employers short and succinct, really, and making sure that they're accessible and not to overwhelm them with information. Another key recommendation was really sort of acknowledging who the target audience is. So where possible, basically really highlighting what information is for large employers, what's for SMEs, but also for specific sectors as well. And and also important, and another one is basically adapting the toolkit, so being able to adapt them and to have really good case study diversity. So really sort of highlighting again different sectors and different types of businesses. Another key recommendation was really to improve the promotion and dissemination of the toolkit. So both PhD and BITC do use our official channels to promote the toolkits, but it's really about how can we engage more of the business sector, how can we attend more webinars. So in the last couple of years, both PhD and BITC really made a conscious effort to come out to spaces like this, to forums like this, and talk about the toolkits and get practitioners and businesses to think about how they can use these toolkits to improve the health and well-being of their staff. And finally, a key recommendation was the need for an overarching more general health and well-being toolkit. And here it is. So we based on this evaluation, PhD and BITC worked together in producing this overarching toolkit, which summarizes the 8 toolkits together, really, and really sort of brings them together in a clear, easy and accessible way, using key things such as infographics, visuals, and really a step-by-step guide for employers. I think one of the main thing I love about this product is that it just allows employers, wherever you are on the journey, because we can't assume that all employers are on the same health and well-being journey. So it really allows them to sort of navigate easily through it and think about where they are. For example, some organizations don't have are lucky to have strong leadership in the area, in this area, but others might not have that. So it's kind of helps you sort of navigate where you are on the health and well-being journey. So this was published in January 2021, and it's available on the BITC website with the other toolkits. And following the evaluation, we've again done a lot of things to improve the toolkit suite. One of the things that we've done is we've updated the mental health toolkit for employers, as Louise mentioned, and this was published in January 2021. We've also tried to be more consistent, and we recognised that there was a need for an infographic summary for the suicide prevention toolkit. So we developed this, and this was published in 2020. We've also improved the accessibility of the toolkit. So now they're all grouped together on BIT's website on its own web page, and we've improved the dissemination, as I've discussed. And we've also been reactive to how things work, and open to how things are progressing. For example, due to the increase of domestic abuse during the pandemic, we're working currently now with ADA and BITC to update the domestic abuse toolkit, which will be coming out in spring. And finally, something I'm very happy about is that other parts of the system have recognised the importance and value of these toolkits. So back in 2020, Greater Manchester Authority asked us whether they could use the mental health toolkit to create a localised version of it, and we said yes. And we said, look, here it's yours, information is there, use it and localise it. And that's something really important about that. People recognising the importance of these tools and personalising it. And that's it from me. So happy to take any questions. Louise, is there anything else you'd like to add?
I just feel, this was a culmination of kind of nearly 3 years' work, which led to this summary document. And the summary overarching toolkit, it's really succinct. All the kind of facts and, are in really, really, really kind of tight infographics with all the key actions. If you're going to read one thing, read that. And then if you want to have more information about any of those 8 topics, then you can dig deeper into the main ones. So I urge everyone. I'm actually really proud of this piece of work, because in terms of what lies underneath it is huge. So please do check out the summary.
Brilliant. Thanks, Louise and Manuel. That's really nice presentation, and people are already saying on chat what a great resource they are. There's some really interesting people who are in the audience. So we've got Deloitte, who've done a lot of work on mental health and employers and the return on investment. So do get in touch with Cara Taylor there. And Karen Taylor, sorry, I'm just reading from the email. And Karen, you're welcome to come in to add to this conversation. There's also people from, Zenia Kumi from City of London Corporation. He's going to be for Mental Health Awareness Week next month, talking about mental health and accreditation with various other people, including I think people from Deloitte. And then we've got someone from various health and wellbeing platforms and resources and trainees and C3. We've also got Orca, who we partner with on sort of app guiding people to quality apps, so to check them out. British Society of Lifestyle Medicine, and I put something in the chat about the sleep network which they're part of, and people doing work from diabetes to occupational health and the chemicals industry to workplace stress risk assessments. Emma Hallam, I mean, that's, for us, from our perspective, I mean, these toolkits are absolutely essential, but also a kind of fundamental is sort of looking at it from a risk assessment approach. So very much I think that's, Emma's work and strong risk assessment, particularly with COVID, for mental and physical health is really, really important. And then we've got National Voices, who, great sort of patient voice. So I don't know, I'm just kind of running through people who've said hello, and that is, welcome to come off mute and ask questions to Louise and Manuel. There's a question from Antonio Bunnin about, can you share examples of how organizations are using the toolkits to design and introduce employee support programs in the workplace? Good question. So yeah, Louise, Manuel, have you got any, probably particularly Louise, any examples?
Yeah, well, Manuel basically is closer to the evaluation that the Work Foundation, and I think one of your slides touched on the different ways that organizations are using. Do you want to take this question, Manuel? You're mute.
So I think organizations are using it in the sense of different ways. So one of the ways is kind of sense checking and sort of seeing, what's in the toolkit and what's in their policy. So using it as a kind of sort of like a fact, like a sort of sense checker to really see what's in there. And I think other ways as well is, sort of seeing what policies are there and how they can be developed using the toolkits. And also, again, in terms of raising awareness, in terms of, using toolkits to raise awareness on issues such as sleep and domestic abuse that they might have naturally not done. So those are for me the key ways in which they've done that.
Yeah, I mean, the other thing that I'd like to talk about, where you've got really challenging topics like domestic abuse, like suicide, and basically you have, you know, I hear anecdotal stories the whole time about, you know, people wanting to get this on their boardroom table.
Yeah.
Toolkits are a very good way of actually getting the exec to sit up and take notice. There's a kind of competitive thing around a Me Too type thing, you know, so because PwC was so open about talking about preventing suicide, but also the kind of reflections and
Paris, nice.
that's very powerful, and do not underestimate, obviously, the business and the moral case. Nick, you're mute.
Yeah, I was just there's a bit of background noise. I was looking to mute someone from one of my favorite activities is pressing the mute button if there's any kind of funny things that get a stupid power trip from it. I've put something, I really like this blog, which I put on chat, which is from Carnegie UK, and I know it's a bit unfair on the presenters, Louise and Manuel, because we haven't read it, but I suppose it's the point they're trying to make is about the shift to hybrid working, which a lot of people are interested to do. Although some organisations like Goldman Sachs, everyone's back to work nationwide. Everyone's, you know, can be wherever they like, and then other people are looking at hybrid. But I suppose what this blog says is it's not a fair flex, and you know, there's particular impacts on women, for example. Some job roles can't flex. There's, you know, working at home is isolating and, you know, difficult with childcare and homeschooling. There's a sort of gender dynamic to that. So obviously this is a moment where employers are weighing up these considerations, looking at approaches and adapting. Certainly SOM, we're looking at that. Have you got any comments about flexible working, hybrid working, and the point of this blog is about, you know, whether it's fair?
Well, I haven't read the blog, Nick, but thank you for giving us the kind of overview. So basically, we are in the process of this is in the community of producing a white paper that's coming out at the end of June, which we strongly believe that we have a once in a lifetime opportunity to actually rethink ways of working that absolutely enhance well-being. You know, we've seen literally overnight that what was sort of deemed impossible in terms of kind of remote, flexible working at scale could never be achieved, and it has. So how do we actually build on taking the best bits from that? Obviously, one size doesn't fit all. And we know that actually to do with maximizing well-being, one has to take a very personalized individual approach. So basically, in terms of the importance of giving your people a voice, which is actively listened to, and that's not a once a year, you know, staff survey. You know, we would recommend regular pulse surveys and listening forums, that you are inclusive, and basically also consider your frontline key workers, that actually in some cases you might not be able to create a totally level playing field. So I think it's horses for courses, but you absolutely need to listen to your people and to find out what they want.
Yeah, well said. Manuel, have you got anything to add to that?
Yeah, I think from my perspective, when I talk about, you know, one of the things I'm most proud about working at PHE for the last 7 years was its flexible working policy. and I speak as somebody with carer responsibilities. So I have two parents that are over 80, and my dad has Parkinson's. So for me, I've always benefited from having an organisation that supports flexible working. So allow me to work from home, allow me to go to doctor's appointments. Having a line manager that really supports me, and as and that for me has been I can't thank them enough as an organisation. And it's one of the reasons I really enjoyed working there. And it's made me, I think, more I would say, much better, happier worker, basically being able to have that sort of flexibility. So from my experience, I think it's obviously, it's, as Louise says, it's personal experience, basically. I think, employers should recognise that.
Thanks, Manuel Louise. Okay, so in terms of comments and questions, so Sam has said, how can we spread availability of these toolkits, particularly HSE? I'm sure you've thought about your dissemination, but HSE do have that good reach. And so one question about dissemination. Another question is about, from Antonia Bunyan, about death, grief and bereavement, a really important issue. So any comments on that? Denise is talking about diabetes, and then there's a comment about flexible working. So I suppose the questions are about dissemination, bereavement, and anything about kind of the diet related to diabetes.
So to do with death, bereavement and grief is, this is not about normal death in service. And actually at the start of the pandemic, a really close friend of mine died of COVID. And in terms of the impact that had on me, in terms of not being able to say goodbye, not being able to be with him, to grieve with our friends, or even have a kind of funeral occasion. We had to wait 2 months and only a few people could go. I actually challenged National Grid and KPMG about this, that actually this is something that employers should really think about, and worked with them during COVID on a freely available death, bereavement and grief toolkit for employers. And basically I actually think it's pretty good. It's been widely used, but also the Sue Ryder organisation have also produced a very good one, as have the NHS. But death, bereavement and grief are huge as social distancing continues. And I really am concerned about the long-term impact of potentially post-traumatic stress disorder to do with that, which obviously in many cases it's too early to say. But I do think the kind of ongoing impact is going to be profound. To do with diabetes, maybe Manuel, is there something you could respond to?
So I think obviously diabetes is a big issue, and I think I think diet and nutrition is a big issue, when that's one part of it. But I think that's something that that is it's covered in the diabetes toolkit. And I think obviously diabetes, managing diabetes in the workplace has has its challenges. So I think it's something that maybe we could look in the future of doing, really.
So to do dissemination, anybody who's on this webinar, if you want to basically promote the link to the toolkit suite, which includes the summary, you're very welcome to do that. But please do not kind of take the PDF and put it on your website, because this is public money. We absolutely need to be accountable for kind of downloads and stuff like that. But you're very welcome to share the link from Business in the Community's website on your own website, and you don't need to ask permission for that.
Okay, thanks very much, Louise. We've got to be respectful for people's intellectual property and payment. So absolutely right. So just looking at people who are brave enough to go onto video, and Derek Reel, Sharon and Tony Bunnin, and anyone else who wants to come off mute or video. There's Karen Taylor from Deloitte, Sam Rayan. So, welcome people on video, Sam. It's always nice to see people's faces and see how you are on a Friday morning. So welcome to come off mute. We've got about 10 minutes left. Anyone want to make any comments? Derek?
My comment is I'm very like you, Nick. I was out last night as well, so I was 4 a.m. out. So I'm just, I suppose one of the things I'm doing a bit of work with a couple of organizations, and particularly around them, the return to office thing and things like that. And I've used the work from business and community before, but I suppose it's, looking at a way of getting some sort of structure to that around guidance for companies, because there's lots of questions around hypervigilance and things like that. What people might be like when they're coming back to the offices. I'm just wondering whether there's any good guidance around for that. I know there is some, but have you looked at that at all?
So this is something on a high level that we will be covering in our white paper. But at this point, I'd actually like to plug what SOM have done on that. Nick, do you want to say, because you've done some really good work on that?
Yeah, I mean, thanks, Louise. I mean, I put on the chat about our return to work toolkit, and it's a very clever piece of work actually, because it's relating to risk assessment and your risk, particularly if you've had the vaccine or not. So in a way, it's I'm sure someone like yourself, Derek, from a kind of health professional background, and probably most people here today would find it really helpful. It's perhaps less so for people who aren't sort of health professionally kind of cultured, but yeah, and then there's other things, and say in terms of, if you look on our website, we're particularly concerned about long COVID, 1.1 million people potentially, and we've got various resources for managers and employees on that, because in a way, long COVID, it's a return to work issue. These people, if they get the right treatment, and sometimes time to heal, specifically, I'm not a voice for someone with long COVID, obviously, but from what I understand, people have perhaps multiple conditions, and if they get each one sort of focused and treated, which sometimes the NHS finds hard, then they've got a really good chance of returning to work. And so we're particularly concerned about that group, and had a kind of summit on it, and talking to CMOs about this. But the main one, I think, is at the top. I think I put in terms of kind of return to work toolkit. So just a bit of clarity, Louise. Just, are we permitted to share the toolkits with our network? I presume it's okay to share the link, but not put it on all your website. Is that right?
So it absolutely isn't okay to lift the PDF and put it on your website. But if you want to share the link to BITC's website where the toolkits live, you're very welcome to do that. But make sure you share the link to our website, and you don't, otherwise we won't be able to be accountable to our stakeholders and to PHE public money that we need to account for.
Absolutely. Thanks very much. Okay, so just kind of, it's a bit like a kind of roll call of teacher in morning class, but Chris Poynton, Sam Raymond, Karen Taylor, Catherine Stone, Siobhan Woodland, other people. Anyone want to come off mute? If you're brave enough to go on video, it's nice to see your faces, I have to say. So welcome, Sam. There you go. And Karen. Karen, why don't you go first then, Sam?
Okay, hi Nick, and thank you, Louise, Manuel, everyone, for really interesting and stimulating discussion and on content. I'm doing a current research piece on the future of public health, but we also, as well as looking at it from the public health side, we also want to consider the role of employers for the public health of their employees, which I think has come to the fore during the past year more than ever. I have been involved in a number of publications trying to raise the profile and support employers to address public mental health issues, but the wider public health issues is the focus of this one. So I'd like to follow up with you separately. We have got a sort of structured interview if you would be happy to take part in that, but I've given you my email address, but also I think all of the issues you raise are really important. My only question is, with so many toolkits, and how do people prioritize? How do you get people to really take it seriously? Because they could be seen as nice to have. They can be things that people dip in and out to, but actually getting employers accountable for some of these things. I'd just be interested in your views.
Well, I think a lot of this, isn't it, about knowing what the needs of your people are? So it's back to the one size doesn't fit all. So basically you need to know the kind of health status and how your people are feeling. And that should be your starting point in terms of actually tailor making something that's bespoke to your particular demographics and your organization and the nature of how they're working. Which is why I was talking about the importance of an active listening culture and actually being okay to speak up. But it's also about, in terms of how employers go about this, is everyone will have heard about, you know, the rise in empathy and compassion and inclusion, and, you know, interesting to see what happened to the chair of KPMG in terms of being called out by his own people to the point that he resigned. So actually, in terms of going about this active listening and responding with empathy, compassion, and inclusion is absolutely key. But also in terms of new business models that actually reward that empathy, compassion, and more emphasis on kind of emotional intelligence and social skills. You know, it's back to David Brent from The Office. You know, even someone like him, you can actually learn a degree of empathy, you can learn the basic dance moves, and actually we're seeing more organizations actually including empathy training. And just, Karen, just to say, is your colleague Sarah Flanagan and Emma Todd, they're actually joined in with the work that I'm doing, so you might want to speak to both of them as well.
Okay, that's good to know.
And I'm really happy to, if you want to contact me, you're very welcome. So louise.aston@bitc.org.uk.
Thanks, Louise. Sam, sorry, I put you second. Off you go.
That's okay. So no, thank you very much, Louise and Manuel. Very, very useful. I work with a lot of small businesses in the Southeast, and I think the main thing is sharing the availability of these amazing toolkits. And then often I speak to a lot of the businesses about health and safety exec. They've got the stress management resources. And what I'll definitely do is spread it through networking, chambers of commerce. And I think that's the thing. There is so much information out there. This is so much needed. And I'm just wondering if there's any other way of making these more available to more businesses. I'm on LinkedIn, I'm at networking. Is there anything else we can do?
Well, brilliant. Is stick the link on to your LinkedIn, Twitter it. The more promote, the better, because, you know, basically in terms of kind of gold standard resources, you know, with working with Public Health England, the evidence is rock solid. And as I said, to do with mental health one, we've just updated, and the domestic abuse one, which really concerns me, is coming out on the 13th of May. So please promote as far and wide as you possibly can.
Yes. Very happy to do that. Thank you so much.
Thanks very much. So in terms of my kind of being the class teacher, you're free to go now. You know, it's 10 o'clock, but if people want to stay to have a chat, that's kind of the point of it, is in a way, you know, kind of go up to the teacher at the end and say, Miss, you know, what about this? So thanks to everyone for joining who needs to go. But for people who just want to, I hope you're okay, Louise and Manuel, just to stay on just for, I don't know if there's people like Catherine Stone or others, or I'm just randomly picking you off, Catherine, don't know why. But it's maybe the sun's shining in your face, that feels good. But any other comments? Oh, Ario has done a thumbs up. I don't know, that's a hands up. I haven't seen it before. So thumbs up for you, Louise and Manuel. Any other questions? It's okay, off you go.
First of all, thank you ever so much, everybody, this morning. It's so helpful and lots of resources to take away and to research further. So thank you very much, because, you know, a lot of this is, you know, there's help out there, but knowing where to go for that is just brilliant. Thank you. Something that is on my mind very much is, as the world opens up after COVID, and, you know, staff are asking questions about what about this and what about this and when are we doing that, and I understand, you know, and it's great to hear there's a white paper coming out on this, but I'm thinking about the here and now, you know, and I think I must have missed it in the chat. Nick, you said something about you've got a link to your website on return to work after COVID. Did I hear that correctly?
You did. I'll put that link in.
Would you mind reposting it? Thank you. Yeah, this is something that I think we have to be handled so carefully, because there's a lot of anxieties about returning to work after COVID, and it's a very personal decision as well, isn't it? About, you know, we've all got different reactions to the whole COVID situation and returning to work, and as well as our personal situation. So thank you very much. That's great. Return to work guide. Fantastic. Thank you. That looks perfect. Thank you very much. Sorry, I shall go and mute myself again now. So. Great.
I've put one. It's one for managers and one for workers.
Brilliant. Thank you so much.
Well, look, I mean, we're a small, perfectly formed group of now, a bit less. So I think before it gets too small, I might just do a final thanks to Louise and Manuel. Thanks C3 as a partner organisation. We've got one actually on heart failure next month, which I think is really, really important, and you know, just kind of a bit more kind of back to normal kind of issue, but a really important issue actually. People with heart failure, there's a lot of people, so look out for that. And then there's further ones. We've got someone from IBM coming along, so that's good in terms of their experience. But I'll shut up and thank you all, and hope you all have a good day. And I'm going to have a nice cup of tea and try and hydrate and go for a walk in the park until my physical mental health improves following my very short, and I can't really handle it, pub trip. But thanks, Louise. Big round of applause to you. Thanks, Manuel, and for everyone for attending. Have a good day.